minimum possible risk towards it. Now, the operator should adhere to the same precaution as in regular fluoroscopy. Now, already that we are discussing some other lecture. The number of CT acquisitions should be as few as possible and the duration of the administration as short as possible. So, the data should be acquired in as fast as possible, and second thing is you should do the procedure as quickly as possible. You should take proper precautions to get saved from the radiation. You have to save yourself as well as your staff. Now, a low dose single rotation axial scan is often sufficient to obtain information about the status of the procedure. It is required before procedure and after procedure. So, it is very obvious that we are doing it with axial to reduce the radiation dose. Now, dynamic CT fluoroscopy should be applied when one axial section should not provide sufficient information. So, this should be reserved only for certain cases where axial scan do not give informations. The workers present in the CT room during this fluoroscopy should be protected. It is not the protection of radiologists, it is protection of the staff and also a patient. So, we should take proper precaution, we should wear radiation badges, we should wear a lead apron, and we should take all the precaution to get ourselves saved from the radiation. Now, special care should be taken to avoid direct exposure of hand of the operator. The operator should manipulate a needle during the fluoroscopy only when it is required, and a proper distance, because radiation follows the inverse square law, should be followed. The hand of operator and the X-ray beam should not be in a direct axis as far as possible. Thus, a direct radiation should be avoided as far as possible. Now what is the take-home message? Due to change in machine design, radiologist stand adjacent to the couch and has got two controls in his hand. One is same as that is the console, and second is about the maneuvering of the table up, down and all that thing. A control panel having all the functions of CT console is towards the right side, and in front of it a control for table movement either up and down or in and out. So, both the controls are in the hand of radiologist. There is a precise visualization of needle vessels in the fluoroscopy mode, so also in static axial mode. So, with that, there is another additional thing. This is extremely essential for brain and spine localization because vital structures are around it and we have to protect them. In CT fluoroscopy, since we are achieving 3D effects, we have to get ourselves tuned to the 3D orientation. Its advantages are so many, but the main disadvantage